Hello and welcome. You're watching Health and Wellness Save a Life. Life is very precious, and the sign of being alive is the continued pumping of your heart. When your heart stops beating, you can get into a cardiac emergency. A medical emergency may occur at any time for any person, and as per the WHO census statistics, the mortality due to cardiac causes has overtaken the mortality that is caused by all cancers put together. The concerning change in recent times is that the onset of heart disease is now being seen at a much younger age, especially in people who are in their 30s and 40s. The biggest reason for this heart-related deaths are lack of awareness as to what needs to be done in a cardiac emergency situation. Now, every adult should know which conditions qualify as heart-related or medical emergencies. And the best thing that one can do is to learn beforehand some of the actions that are required in case of a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It is even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of early symptoms and signs of cardiac arrest so that patients can get into a hospital in time and also be trained on giving CPR if the need arises. Today we have with us a panel of expert cardiologists who can help you understand what sudden cardiac death is and the role of CPR to revive and save a life. Dr. Prithviraj Pawar, interventional cardiologist from the Tulip Heart Care Centre, Anand, is with us. We have Dr. Jagdish Harmat, Director of Cath Lab, Ruby Hall Clinic, Chair of the Preventive Cardiology, Pune. We also have Dr. Ashok Kumar, Consultant Interventional Cardiologist of the Sadbhavna Multi-Speciality Hospital, joining us from Fatehbad. Thank you very much, doctors, for being with us. Dr. Kumar, to you first. Cardiovascular disease is the #1 cause of death worldwide. Which cardiac emergencies can essentially lead to death on the spot?
Well, the heart disease that can cause death on the spot can be broadly classified into two groups. The first one including the age from first year of life to 35 years of age, and the second one is from 45 to 75 years of age. The first group includes the disease that are first the congenital heart disease, the disease that are present since the birth, and the second ones are the myocarditis, maybe due to some infection affecting the heart causing the death, and valvular heart disease, the disease that affects the valves of the heart, and myocardial disease, the disease that affects the muscles of the heart. And in second group, coronary artery disease are the most common cause of death that can create heart attack situation. And the other disease like cardiomyopathy are also included in this group. The cardiomyopathy are the disease of the muscles. Broadly, these can be classified into two groups: dilated cardiomyopathy, in which the heart is dilated, muscles become weak, and pumping action of the heart decrease; and the hypertrophic cardiomyopathy, in which the muscles width increase and the disarrangement leading to dysfunction of the heart. And the last one is the arrhythmic disorder, in which this electrical system of the heart can affect and leading to sudden cardiac death.
All right, Dr. Jagdish, what are the pre-existing conditions that may increase the risk of cardiac emergencies?
Yeah, many of them fortunately got listed by Dr. Ashok Kumar. We must know that a cardiac emergency is sudden cardiac death or sudden cardiac arrest, wherein the heart can stop completely or beat at a chaotic pace, which is ineffective. So this can happen because the plumbing system failure, as in heart attacks, coronary artery disease, or it can have somebody using long-standing diabetes, hypertension, smoking, this kind of risk factors in him. And others, they are called the structural heart disease, like the valve disease, the heart muscle disease. All of them can lead to a cardiac emergency. Even a strong electrical shock can lead to a cardiac emergency, or where the rapid fluxes of sodium and potassium, as the people who are on dialysis in kidney patients, or somebody gets severe diarrhea, dysentery, they get recalled electrolyte imbalance. that also can lead to cardiac. So any pre-existing cardiac condition is a definite risk for somebody getting into, as you mentioned in your introduction, suppose somebody has a cardiac disease already, he is the one or she is the one who is prone for developing cardiac emergencies.
Right, Dr. Pawar, are symptoms of heart attack or cardiac arrest different for women and men?
We all know that commonest symptom of heart attack is a chest pain, right? So both the genders usually presents commonly with left-sided chest pain, which may be associated with the left arm or a shoulder heaviness. However, women may not have this typical presentation. In contrary to males, who usually presents with chest pain, compressive type or tightness in chest, women might present with unusual symptoms like pain or pressure in lower abdomen or upper chest or a lower chest, along with jaw claudications. Sometimes women don't have chest pain, but they have generalized fatigue with or without giddiness. They may have heaviness in arms, or they might just present with shortness of breath or dyspnea. So shortness of breath or dyspnea, which is unusual and it is in acute or a sudden onset, might be a warning signal or a symptom of a heart attack.
Right, that's very crucial to know. Dr. Kumar, what are some of the emergency actions that one can do to help someone who's, possibly experiencing a heart attack or a cardiac arrest?
Well, if the possible emergency action that can be taken in the patient is possibly having heart attack. So as discussed earlier, that the most common symptom of the heart attack is chest pain, heaviness, and sweating. So if you saw a patient if a person is having such symptom, so some emergency medications can be given to him. In these medicines, the chewable aspirin is the first one, and sublingual nitrate can also be given below the tongue. So once the patient, and after that patient, this person can be shipped to the hospital. Over there, the ECG can be done, and the final diagnosis and treatment can be further uh, taken care of the patient. And if you see that the patient is having such history, and if he collapses, and in such person, you have to first feel the pulse. If the pulse is not there, then one have to start the CPR with chest compression, and try to maintain open airway and call for help and call for emergency medical services. And CPR should be continued till the emergency medical services arrive, or automatic electric defibrillator is arrived, or any trained person that take over this CPR. So, till the help arrives, the CPR should be continued. So these are the something that can be done with a patient with a heart attack. If a person is having already known case of like seizure disorder, like diabetes, so in which one have to make the diagnosis whether this is a kind of a seizure or some mimicker of the heart attack, like if the patient is suffering from the hypoglycemia, that is lack of sugar.
Right.
So
Right. Dr. Jagdish, what is the ABC, the basics for CPR? Do we need to check the airway first and then perform CPR? What are some of the basics that you'd like to tell our viewers?
Yeah, this question has gained relevance now after the advent of Corona. ABC used to be, as we were taught in our undergraduate days, was airway. That means see that the breathing passage is good. We check whether the breathing of the person is there and start breathing with a mouth-to-mouth breathing. And C was cardiac compressions or the chest compressions. So if we divide into a bystander CPR, which is a bystander, somebody collapses in the road or in a mall, then a bystander CPR should not look at the ABC at all. They should do just chest compressions. The feeling is that be safe, don't give mouth-to-mouth breathing nowadays after the corona. But if you start chest compressions and start the heart, maybe the breathing will take care of itself is the philosophy. So what we are looking at is really start the heart, maintain the heart compression so that the blood supply to the brain and other organs is maintained, and then itself will start the breathing. If you get tired of doing the chest compression, change of hands, and somebody else can do the chest compressions at about 100 to 120 compressions per minute. This should be continued, of course. So well, let's say put it this way, that now the ABC for a bystander CPR is only chest compressions, and chest compressions. Whereas if it happens in a hospital where all the other equipment is available and medical personnel is available, then we follow the rules of ABC. But I think for population at large, we must know, forget about ABC, just do the chest compressions and you could save a life.
Right. I think that's very important information as well. Dr. Pawar, just getting into the specifics, what if a person who's undergone open heart surgery only recently gets a cardiac arrest? Can CPR still be performed on such a patient?
Yes, we can perform. We may divide occurrence of cardiac arrest post-surgery into early and a late phase. In late phase, once sternotomy or the wound of a surgery is healed, then there is no difference of CPR and conventional ACLS protocol is followed for CPR. In case of early cardiac arrest, occurring after any chest surgery, not only the bypass surgery, the approach is different. Immediate post-bypass surgery or a chest surgery, if arrest occurs, that is very common also. In such cases, first reversible causes we need to find out by the treating doctors. One may use pharmacotherapy or medical therapy as well as pacing whenever applicable. And if this initial applicable steps does not help, and of course nature provides a time, then resternotomy can be done and a direct cardiac massage is given, which is done under strict aseptic conditions. Occasionally, immediate post-surgery arrest may be faced after a discharge from hospital. In those cases, even resternotomy is an option. It can be done. However, based on situations, it carry a poor outcomes in contrary to which is done in ICCU setups.
Right. Well, we're going to slip into a very short break, but we have a lot more questions lined up. Those coming up on the other side. Stay with us. Welcome back. You're watching Health and Wellness, Save a Life. We have a panel of expert doctors talking about emergency measures and helping us understand them better. Dr. Kumar, there's always a fear that if a person is giving CPR and that person is not well trained, he may cause serious damage to the patient. Does India have a clear law on this, and what is the liability of a rescuer when attempting resuscitation?
Well, the fact is that CPR saves a life. Still, there is a chance of survival is there when the CPR is performed, whether it is a good CPR or bad CPR. So, almost around 50% of the death from the cardiac arrest can happen if the patient is remain unattended or CPR is not done. Of course, there are some of the injuries that can happen with while performing the forceful CPR. These are very few, actually around 10%, and these injuries can also be managed once the patient's life saves. In the hospital setting, in ICU setting, these injuries can be managed. So, according to my knowledge, there is no such law in India is there for this rescuer of the CPR.
All right, so no such law in place. Dr. Jagdish, a heart attack or a sudden cardiac arrest is more likely to occur in people with existing heart problems or with individuals who have diabetes. What information should they carry with them while they are, say, traveling?
I call it a health card. That means you should carry it. It should be hard copy, not stored inside your smartphone, because it may not be available at that crunch of a time. You should carry a hard copy of health card, which mentions, of course, the basic things like the name and the contact number and the weight, full diagnosis of the clinical condition you have. It should also mention the number of tablets he's taking, number of medicines, and the doses related. And of course, any cardiac surgeries or any other major surgeries that have been performed in the past. If this is concised and put into a card, and if that person carries like a health card, it will be of immense help for people who are trying to save his life. So it will help socially for people to contact somebody on an emergency basis. And also if he reaches the hospital in the nick of the time, The doctors there may not have to go through his records and other things and still quickly ensure that the right treatment is offered to him. So this health card for travelers is absolutely is a must, and we should think seriously about it. And of course, all these such patients, when they are traveling, probably take precautions to avoid a cardiac emergency so that they remain hydrated very well. They take their medicines properly before going into the airplane or long travels. They don't consume too much alcohol on the way and other things which they can inform somebody as soon as they start getting the discomfort. So if these things are followed, I think the travels could be made very safe.
Right. I think that's important information for travelers, and very important that you highlight it should be physically carried, not something that's buried in your smartphone which people can't access. Dr. Pawar, how does an automatic external defibrillator, an AED device, essentially help a person who is in a state of cardiac arrest?
These AEDs or automated external defibrillators are integral or very important part of CPR. They are lightweight, portable, computerized devices which delivers a shock. When there is a cardiac arrest, the abnormal rhythm is a cause of cardiac arrest, then these devices have a capacity to convert shockable rhythm into a normal sinus rhythm. That way, if it is delivered in time, then increases the chances of survival by CPR. These AEDs are now available in most places like airports, railway stations, metro stands, corporate offices, schools and colleges, etc. They can be applied and given to both the genders and all age groups above 8 years old child. In case of children 8 years or below, the devices are little different in that way. The pedals which are used are smaller in size and the delivered shock should be of a lesser strength. But in general, no any person should hesitate to ask for or to use this novel device in case of cardiac arrest.
All right. Dr. Kumar, what happens if you perform CPR on someone with a pulse?
Okay, fine. If we are doing a CPR once the person is initially not having the pulse, initially collapsed person, and if we are doing the CPR with chest compression, if the pulse return, then one have to stop the CPR and just keep open the airway and wait for the emergency help. And if the patient, if someone is having collapse and just try to feel the pulse. If the pulse is there, then just keep open the airway. And we know that in corona time, this mouth to mouth breathing is not a favorable thing. So further things can be taken care after the emergency medical service arrive, or patient can be shipped to hospital, and in the hospital the intubation and mechanical ventilatory support with the oxygen therapy and all other these investigations can be done. So once the pulse is returned, so one should have to stop the CPR. One should only have to take care of the airways.
Right. Dr. Jagdish, how long does it take to recover from cardiac arrest, and what are the treatment options that are available?
I would say that one should keep doing the CPR till something happens. For example, the patient wakes up, or the AED machine arrives, or some medical help comes, or the ambulance comes by. All of us cardiologists can quote to you CPRs done for half an hour, 45 minutes inside the hospital, and yet the patients are now moving around and leading a normal life. So it's best to keep going. I think the idea to remember is I should not be using these words in a death situation, but it's a win-win situation, because if you cannot revive a person, unfortunate, but you can't harm the patient for sure. So you have to keep going with the CPR for as long as you can, and these things can happen. The 30-minute CPR is possible to do. After that, it is possible to have a person fully awake and fully leading a normal life. There be some element of luck and some element of mishaps that can happen, but one should keep going as long as possible, because that's the only hope that the person who is collapsed has, and you are the one who are the bystander, so you have to you do your best as long as you can.
Right. Dr. Pawar, what are the after effects of a cardiac arrest and what precautions should a person take after being discharged from the hospital?
Well, post cardiac arrest, there are chances of residual neurological deficits, cognitive dysfunctions, and also during CPR, there may be injuries to the ribs or intra-chest organs. So all these possibilities needs to be ruled out and treated while in hospital. Once person is discharged from the hospital, then we usually recommend or suggest to go for a neurocognitive assessment, which is very important part of post cardiac arrest rehabilitation. They also should be instructed to seek frequent medical attentions for periodic checkups and assessment also so as to avoid similar episodes of SED or a cardiac arrest, which is common once someone has faced the cardiac arrest.
Right. Dr. Jagdish, final question to you. What's then the appropriate diet?
Coming to basics, I think diet does form a very important aspect. I think all of us adults, maybe we should restrict to this advice to them: eat for your body, not for your tongue. For your tongue, leave it only for the Diwali days. Maybe there could be some cheat days. But most of the time, we should know what diet is good for the body and good for the tongue. And then I say that if we eat 3 times a day, it's about 100 times in a month. So 90 out of these 100 times, I would be disciplined enough to eat for my body, and maybe medically correct food or the traditional Indian food of dal, chawal, sabji, roti is wonderful diet actually. The fancy ones which come maybe for indulgence would be left for about 10 in a week, which would mean about 1 to 2 twice a day. Depending on your age, your discipline, your ability to do this, it might vary a bit, but the principle should be to remain like this. Avoid salty food, spicy food, carbohydrates. All this is very well known, but the implementation of that matters. Dining table should be talking about how to hold a fork and knife, but you should also talk of what is good for our body.
All right. Very important advice there. I think that's one of the cardinal rules. Thank you, doctors, very much for joining us on the show.